Yes, and so the fallout here, right? So we tried to dig kind of deep into this before we recorded this, because a long time ago, right when we started the show, like one of our first episodes, we did a deep dive into healthcare, health insurance systems. We looked at a bunch of foreign countries which have systems that are way, way more efficient than ours, normally because they have universal health care, government-provided universal health insurance as some part of their program. And I remembered, like, one of the things we looked into, one of the things we learned about was called a capitated system. And so I was like, okay, capitated system. They're thinking about a per capita block grant. Is there any similarity here? Turns out there is. So part of the capitated system of these foreign governments, of these foreign universal healthcare programs, is to, again, allocate an amount of money for each patient that is served at one of these hospitals or doctor's offices to cover their health care for the year. The difference, and this is where, like, seeing where this bill nets out is going to be extremely important. Mm-hmm. Like, the nitty gritty here is going to matter a lot. The difference is that in these foreign countries, the general practitioner care is what's covered by this block grant. So you don't have to worry about variable costs that much when you're thinking about just like the twice a year checkup that someone's going to get, right? You don't have to worry about, oh, if I give, I don't know how much it costs, $1,000 for each person to get checked up twice a year, or $500 or whatever it is. There's not really a chance that like maybe inflation is kind of higher that year, but you're not going to get blown out of the water. Right.
You're not going to get blown out of the water.
Yes.
Where in this Republican plan, you can get blown out of the water.
Because if you have someone who suddenly gets cancer or any kind of other rare disease, or they get in a car accident and they need an ambulance to take them to a hospital, an ambulance ride costs like $16,000 in the U.S. That's where you start to get really exposed. And these states, and particularly, again, these poorer red states are going to be ones that are like, oh, fuck, we don't have the money to step in for this, especially as the government, because right now the federal government is matching them somewhat on a dollar for dollar. It's not necessarily dollar for dollar,